Okay, so we're going to do a quick anatomy lesson. This is Cindy, and Cindy is status post-procedure. See if you can guess. This was a surgical neck procedure, liposuction of the jowl, laser resurfacing, and several different fillers in different places of her face. So we are about a week and a half post, and I want you to try to guess what is going on. So Cindy, if you give me a broad smile with your lips sort of closed, pretty nice smile, good. Now I want you to bring both of the corners of your lip down like a bulldog, forcefully. That's good. Now relax. Now I want your mouth to make an O ring, just make an O. Now I want you to smile with that little partial opening of your lip. Okay, so have you guessed what's happened? Let's do a little anatomy lesson. I'm going to get Cindy to turn this way, and let's just trace out the facial nerve. Even though Cindy has some numbness in certain areas of her face and neck after such an aggressive procedure, that is all from the 5th cranial nerve. What we're talking about is the 7th, which actually is quite deep as it courses underneath the muscle. So when we're doing a facelift, we have to be thoughtful of this, but it really isn't a problem for an experienced surgeon. So the facial nerve, which operates muscles, it's not sensory, it's motor, it courses. There's a branch called the mandibular branch. It courses right here, and there's a branch called the marginal branch that operates 2 muscles. One muscle is the DAO, or Depressor Anguli Oris, pulls the corner down like this, and in the case of making a patient look more pleasant, sometimes when we're treating them with Botox, maybe we're filling their lips, we'll actually put Botox into this area to weaken that and give patient a little bit more of a pleasant look, almost like a smile. It's almost impossible to make somebody look like a joker with that, but you do have to be somewhat thoughtful always in the dose that you use. Most patients absolutely love the Depressor Anguli Oris, or the DAO treatment. There's another muscle that's also fed by the same nerve, the marginal branch of the mandibular, that's called the Depressor Labii Inferioris, and what it, or the DLI, and what it does is it pulls the mid-lateral lip down, and if you didn't guess earlier, that's exactly what has happened with Cindy. This would be the affected side, and since the muscle here has been weakened by its bruised or stretched nerve supply, this will resolve by itself. It will not be able, it will not be pulled down when the patient smiles, so it's going to be higher on this side. So Cindy, go ahead and do your open mouth smile for me. You can see how it's higher. So what we'll do is we will treat this muscle on the other side so that it will become also weak, and that will allow the patient to have a symmetry until this nerve recovers. The reason this is important is when we're doing any facial procedure, we always want a patient to know that they may have a little bit of a temporary crooked smile. It would be case reportable for it not to recover on its own. And there's always a solution in being able to basically go back to the other side and make sure that the contralateral side is also compromised so the patient is symmetrical. So this is a rare thing that happens in a busy practice like mine. I see something like this about once a year that the patient notices. About twice a year I notice it, but the patient doesn't. So this is something that you should be very familiar with if you're undergoing a facial procedure in which this area of the face has any type of manipulation, anesthesia, or any injectables.